Hey y'all, it's Hospice Nurse Ryan here. So I want to talk a little bit about dementia. So dementia is one of the diagnoses we see quite often. And so it's important when it comes to hospice. Now, if you're not familiar with dementia, you're probably wondering, okay, what is dementia? So dementia is a disease, ultimately fatal disease, where you get a physical and cognitive decline. There's different stages of dementia. There's early stage, middle stage, late stage. Early stage would be like not being able to pick out your clothes, forgetting how to do simple tasks, not being able to drive or forgetting where you are. And then middle stages where it gets a little more advanced, to where you're possibly not able to shower yourself. You are, wandering. You lock yourself out of the house or the car, or you forget how to drive. To late stages where you completely lose the ability to talk, to walk, to toilet yourself, to shower, and those are the patients we usually see. So when a patient is admitted to hospice, they have to be in the late stages of dementia, unless they have other type of diseases to go with it. So what they have to do is basically be in the bed. There's a requirement that says they have to be in a bed, non-ambulatory, incontinent, and speaking six words or less. They have to have recurrent infections like pneumonia, UTI. Sometimes they have pressure sores. So they end up coming to hospice, and we take care of them. We meet them where they're at, and we make sure the family's understanding of what's going on, and help explain that. So, what type of dementia? Types of dementia is there? Well, there's Alzheimer's disease, vascular dementia, Lewy body dementia, and there's a mix of them both. The ones we see quite often are Alzheimer's and vascular dementia, sometimes Lewy body, that sort of thing. And then when they come to hospice, of course, they have to have a diagnosis of 6 months or less to live. But dementia is actually pretty tricky. Patients that may seem like they're dying or may seem like they're at the end of life could all of a sudden recuperate and live another 6 months. Dementia patients eventually forget their family, who you are. They forget just mostly everything. They lose all their short-term memory. But what's interesting is they seem to gain long-term memory. And they bring up a lot of things from their childhood. They remember, what their house was like, what their parents were like, what they've done. And then they lose the short-term memory, meaning they don't remember what they did 5 minutes ago. It's a pretty terrible disease. And, in hospice, we help them through that. We walk them through all the stages. We make sure that there's medications in the house that will control any type of anxiety or agitation. We help with any falls. We always go out to fall calls, especially with injury, and we try to limit the falls as much as we can. Try to do things to help the family keep their loved ones safe. We give medications for any type of pain or shortness of breath or anything like that. But the best thing we do is we educate the families on what to expect. And we go through that. So when their loved one is changing in front of their eyes, they say, okay, the nurse told me that's what was going to happen. I understand now. And the nurse told me to call when this happens. Okay, I'm not as worried about it because he told me. And we end up seeing the patients until they stop eating and drinking and eventually die in their home. So that's a little bit about dementia and hospice, and until next time.